Good evening. I am Karen Sharfstein, and along with Stacy Weiss, we are Women's Philanthropy, Outreach, and Education co-vice presidents. I am so glad that we got such a tremendous turnout for this evening's event that I'm sure you will find extremely valuable. Thank you for joining us tonight to explore this important topic. There are lots of books about caring for babies and raising children, but there aren't as many resources available to help many of us navigate through the challenging years when loved ones begin to age and sometimes decline. And during the pandemic, the isolation many of our senior family members are experiencing only exacerbate their decline. We are very fortunate to have two esteemed professionals in this field to help us with some practical advice and guidance. I will introduce them in a moment. Before we start the program, I would like to share with you a little about Federation's work, especially during the pandemic. Federation's work is very robust and often difficult to share in one conversation, but it's really all about caring for others, especially those that are vulnerable. Federation has unique perspective and partnerships that allow us to understand the most pressing needs in our community. So far, we have distributed over $1.3 million for PPE, senior nutrition, economic relief, and mental health services. That is all because of you and people like you who know that a donation to Federation is an investment in our community. Without further ado, I would now like to introduce our two speakers. If you have any questions, please put them in the Q&A function at the bottom of your screen, and our panel will try to answer them at the end of the presentation. Dr. Terry Katz is an internist specializing in geriatrics. With over 25 years of experience, Dr. Katz has practiced at Columbia Presbyterian, Montefiore Medical Center, and currently is the co-owner and founder of the Center for Dynamic Aging with offices in Teaneck and Fort Lee, New Jersey. Margot Tucker is a licensed social worker with a certification in gerontology and is a CDP, Certified Dementia Practitioner. Margot has an extensive background in care management, both in hospital settings with care management agencies, and now with her own agency as president of Tucker Senior Life Care. Dr. Katz will speak first. Terry?
Thank you. Let me just try to. Um, okay. Hi, I want to start a little bit with what is aging, because that's really what we're talking about, how we're dealing with our parents. And for the sake of the conversation here, even though it won't always be parents, it may be another type of relative, I'm going to say parents. I love this definition. What is aging? It's a ubiquitous, intrinsic, biologic process with a progressive, predictable, inevitable evolution and maturation of an organism until death. I love that definition, and it sounds like it's an easy process, but it does tell you that there's a beginning, a middle, and the end. And our goal as physicians is to help that process be good all along the way. But it's not really a simple process. It's extremely heterogeneous. It's very different experience for each person. As compared to children who are expected to start to walk at 12 months, start to speak at 2, and if that doesn't happen, we think something is wrong. Older people age very differently. It's in a very different experience. People can have normal aging changes, and that's changes that occur, despite perfect health. People develop cataracts, their skin gets thin, they may lose their hearing, their heart changes, the lungs change. Those are normal changes of aging, and that happens to everybody at a different rate. But on top of that, you can have chronic illness, and that can be people having something like diabetes or high blood pressure, and they're stable and they learn to live and have compensatory life skills. They take their sugars or they check their blood pressure. People can have chronic illness that's progressive with a good or poor quality of life, and that has to do with how people adjust to their lives and how the family around them adjusts as well. And then on top of that, you can have acute illness. So you can have people that get an illness and recover. And for the sake of this conversation, I'm going to use COVID since it's so relevant. You can get COVID and be treated and recover. You can get COVID and it can change your life. You can be in an assisted living and there could be COVID around you, and that's totally going to change your life because of the quarantine. Or you can get an acute illness such as COVID and have a progressive decline until your death. So aging can be a very different experience for people. Preparing for changes, where do we start? As an overview, I want to tell you that as someone who cares for somebody, you need to know their normal habits. You need to understand what's normal for them. As I said, normal aging is very heterogeneous and habits can vary among different people. But usually there is a consistency in an individual throughout their life. In other words, the way they like to sleep, the way they like to eat their meals, the way they like to take a shower, when they want to take a shower, how they like to use the toilet, what their daily routine is. So that kind of thing is pretty consistent throughout someone's lifetime for the most part. So that's how we know maybe that we have to get ready for a change, because we see that something is different from their normal routine. The next few slides are going to be geared to who might know what's going on or who should know what's going on. What do we need to know? When should we know? And how do we find out? So who might know, who should know? So in other words, who should know that something is happening in your loved one? Who might recognize it? Well, you'd like to think that if there's two people together, a spouse, that they might recognize it. But I have to tell you, that's not often the case. Because as people have lived together for 40 or 50 years, they take care of each other. They watch out for each other. And as people begin to lose some of their skills, their partner begins to take those over. And you might not even realize within a year or two's time, somebody who used to do the food shopping and cook the dinners is now not doing that. And nobody even realizes why. People might think it's because they're tired or because they can't drive. But it might be something else that's going on, and just subtly, they've allowed someone else to take over their skills. So the significant other is a good source of information, but they may not always realize that something is going on. It could be a friend, it could be a child, it could be the physician who recognizes that something is different, although A lot of times I need the families to be able to tell me, because the office visit is very structured, and the more structure there is, the more people can manage. It may be a visitor who recognizes something is wrong. And I laugh about this, but it could even be the doorman in the building, because who knows the habits better in a building than the doorman, who sees the coming and going of everybody. And if he sees somebody who come down to get their mail, but they kind of are looking like they're lost, they don't know how to go upstairs, or they're just sitting around, they may be the first one to know that something is happening. Maybe there's a UTI and it's affecting them. So I like to say that the children should be wary of anybody who suggests to them that there might be something going on that really may be. Okay, what do we need to know? So I said before about knowing a bit about the basic routine, so you would know if there's something different going on, if there's something wrong. But I think it would be good if anybody in the family, whoever that might be, whether it's a niece, whether it's a sibling, whether it's a daughter, whether it's a good friend, at some point in time, it's good to know what are the chronic medical conditions that this person has. And we'll get into time in the next slide. But if they have diabetes and suddenly they're acting off, then maybe that's because their sugar is low, or maybe they have high blood pressure and they're having a headache and their blood pressure is very high. Usual medications, you'd be surprised that even the most cognitively intact people cannot tell their doctor, their family, their friends what medications they take, especially once the list gets over 4 or 5 medications, which is not at all unusual. So it's good to be able to have a list of someone's medications. And that's not an easy job, because as they go to different doctors, medications get changed and it's really hard to keep that current. Names of doctors is also helpful. Do not ignore the subtleties. I think that I can't tell you how often a family member will tell me something that seems pretty benign to me, but in fact, they're 100% right. They may just notice that somebody didn't eat lunch, or that they don't seem as alert, or they're sleeping too much. And, they know best. They know better than anybody that something is going on. I can't tell you how many phone calls I get from families, particularly for people that are in nursing homes or assisted livings. I spoke to my mom or dad today, and there's something wrong. Nobody's called to tell me, but the family probably is going to know best when there's something different. I have a whole talk about behavior as a form of communication. And I say this for any person, no matter what stage they're in, but obviously, particularly when people have dementia and they're no longer able to express themselves and communicate their needs, that behavior is very powerful. And it's up to us, physicians, families, it's up to us to understand that and learn about it. Particularly in patients with dementia that they cannot communicate. And if they start doing some kind of repetitive behavior, maybe that really means something, and we need to take that seriously. I also couldn't leave out something about advanced directives. We always try to talk about advanced directives, at least having what's called a post. It's hard. I forgot the exact mnemonic for that, but basically it's a piece of paper that talks about a living, a do not resuscitate, or an intubation, or feeding tubes. So it's good that you have some type of conversation at some point in time. But again, this is all about timing, and when do we do this? Okay, so timing is everything. When do you need to get involved? When do you need to step up and say something? Now, I might make this sound easy, but I know very well this is not easy. It doesn't come without a fight. It doesn't come without some arguments. It doesn't come without someone, saying that you're treating me like an infant and such. But it's a process. It's usually a process. Well, I wouldn't say usually, but often it's a process. The same way your child slowly becomes an adolescent. There's a very slow transition from the time someone becomes an independent adult to becoming dependent on others. And every step of the way, things are going to change. So I think I always tell families, don't expect something to happen all at once. Say your loved one's habits, you see that there's something different. It doesn't seem like it's acute that it needs to be dealt with right now, but they're starting to do things that make you concerned. You need to start to have those conversations, take it slow, but start to have them, get the help of a physician, maybe other siblings, whoever it may be that could be helpful in trying to get past this. Today I had a difficult situation in the office. A daughter called me to report all kinds of symptoms, and the patient came. They denied all the symptoms. There was a niece there who didn't want to say anything because otherwise the patient would get agitated. But when the hour was done, we actually made a lot of headway in trying to begin to address some of these issues. But of course, there was no answers yet. Timing is everything. It can be very abrupt that suddenly you have to take over and be involved in helping your loved one. The same way your child suddenly leaves for college and you look in the kitchen and you only have to make coffee for yourself and your husband and not for somebody else, or whatever the habit might be. If your parent suddenly has a stroke that leaves them debilitated, or they fall and break a hip and no longer can live alone, or they suddenly can't drive, all of a sudden you're going to be thrust into that role. Okay, I've got a few more minutes. I'm going to go quickly. How do we find out? How do we find out that something is different, that something is wrong? Spending time together, and maybe Margot's going to get into this a little bit more. Doing things out of the normal routine. If, as I said before, the structure helps people perform and allows them to stay with their habits. But if you have them do something that's not part of their usual habit, that might be when you see that something is off. Visiting their home, looking at the refrigerator, looking at their desk, looking at the bills, the statements, taking them to the physician. You could say, let's go for lunch after, and let's make an outing and try to use that as a way to get his foot in the door. Driving with them, seeing how they drive, how they negotiate. Give them tasks that you think that they should be able to do. These are all things that I'm suggesting might be a way to help you find out whether your inkling that something is not right needs more attention. What are some of the warning signs? Well, any deviation from the norm, I think I've emphasized that. Fall, suddenly somebody is falling. And I don't want this only to be cognitive issues. I just want to say that some of this could be that somebody's got a medical problem, and as a result of the medical problem, they become anemic, so they're weak, or they could have depression, they could have breathing problems. So I'm not just talking about cognitive issues. Weight loss is often something we get worried about, sudden accidents, unsafe behaviors, and again, warning signs, reports from friends or doormen. If your loved one plays cards and suddenly you get a phone call from somebody who doesn't know how to say this to you, but she wants to let you know that she was concerned, I think you should definitely take that seriously. Physical challenges with aging and illness. So, aging is hard. It's not easy. Yes, for some people it comes easier and they adjust and they live well, but for other people it's not so easy, because look at all these things that happen to us. We get trouble walking, we lose our vision, we lose our hearing. Some people have trouble sleeping, they have bladder problems, they don't want to go out because they wet themselves, they don't want to wear Depends. And the biggest one is polypharmacy, about people, they're taking a lot of medications, it gets confusing, they take them wrong. So all these things can make it really hard to age nicely. I think this is my last slide. Psychiatric and cognitive challenges. These are things that also are not part of normal aging, but you can have normal memory loss with aging, but there's a spectrum of where it's normal and where it becomes not normal. There are conditions that can give memory problems, psychiatric conditions that make things challenging, and of course, COVID-19 and quarantine. And everyone here, I'm sure, knows that if an older person did not get COVID, they still have had so many ramifications of this disease, between the isolation and the quarantine and eating alone and not going to their doctors when they should and not seeing their family. That in itself has created quite a healthcare problem that people are addressing. So I'm going to let this move on to Margot, but in summary, I just wanted to make sure people understood that this process of understanding that it's time to step in to help your loved one, it's not easy. It's important. It requires a process, and there's a lot of people around that can help you do it. Okay, I'm going to try to stop sharing my screen. Let's see if I can do that. Escape. There. Okay. Margot?
Yes. Thank you, Dr. Katz, for that amazing presentation. It was chock full of information. And thank you to the Federation and Women's Philanthropy. I'm really grateful we're all together tonight, and you've given me this opportunity to speak with you about preparing for changes in our aging loved ones. I hope after this webinar, it's clear that this journey can be easier when you have the proper support systems, proper communication techniques, and the required information that is pertinent to each individual situation. There's no need to take notes, as all of the information provided will be available on the Federation's website, including references and book recommendations that I'm going to make with further details on the topics being discussed. As Dr. Katz mentioned, don't ignore the subtleties of the warning signs. The warning signs present in a variety of ways, and some are more noticeable than others. It's the subtle signs, as she said, that often go unnoticed, especially because these symptoms could also be explained by minor issues. For example, your mother, who always was dressed so impeccably, is now wearing stained clothing or the same shirt over and over again. Or the father, who was responsible for all of the family's finances, is struggling to pay simple bills. These symptoms could be explained by minor issues or a variety of conditions that need to be taken seriously. These include depression. The mother may feel depressed and not have the wherewithal to even care about changing her shirt, or the memory challenges and cognitive decline, which are obvious with the father, but also could be an issue for the mother. She's having difficulty getting dressed, remembering how to get dressed, and of course, all those physical challenges that Dr. Katz described. I think what's important is that any warning sign could be an indicator of an acute illness and should be evaluated by a physician. As she mentioned, a UTI, a urinary tract infection, can send somebody into a state of delirium, confusion, and it's something that's easy to diagnose and also easy to treat. After you recognize the warning signs, here are the first steps to facilitate more positive conversations before you speak to a loved one. You should learn how to speak with them and become comfortable with what are probably new communication techniques. The first, learn to start where they are. This means understand where they are in their comprehension and how they see their situation. Asking them the question, what is this like for you? For example, the mother says to her daughter, "You never call," and the daughter replies, "I call every day." This conversation highlights that the mother's reality is different than actually reality, so the daughter could start to understand how the mom sees her own situation. Learn to listen. Sounds simple, but it's really challenging. Don't try to fix problems, like jumping in to help the father with the bills. Give him a chance to work it out. By allowing him to try to work things out on his own, it promotes growth and building confidence, and he's being given the opportunity to solve things independently. If he is really struggling, then of course a medical assessment for changes in mental status is warranted. Learn to stop using words such as help and can't. These words set the tone of the conversation that they're not able, which already puts them on the defensive. For example, you need help, or you can't take care of this house. Another way to say this is, could you use an extra set of hands? Or let's try to strategize about what needs to get done around the house. The softer your words, the softer their response. Learn how to redirect conversations that go nowhere. Many times we naturally tend to try and bring our loved ones into reality, back to the example of the mother saying, "You never call," and the daughter replies, "I call every day," trying to bring the mother into reality. The best way to successfully redirect conversations is to focus on the feeling or the affect. For example, with the conversation with the mother, first, Try to start where she is. She may be feeling lonely, frightened, or possibly abandoned by her daughter. With that understanding, you can now change the conversation and focus on the feelings rather than the complaint. That will validate their feelings if they have feelings of fear or frustration. For example, the mother says, "You never call." Now the daughter replies with, "You sound upset." She went right after the feeling, and it stops the back and forth and the daughter banging her head against the wall. By adopting these new techniques, start where they are, listen, don't use antagonistic words, redirect conversations. Our goal is to limit conflict in these conversations and enable our loved ones to regain a sense of control. Losing a sense of control is incredibly frightening and something that they face every day. Another aspect of caring for a loved one is building of a support team. The stronger your team, the better equipped you are for handling the challenges of aging. It's really that simple. The members of a team depend on the individual's current situation, their symptoms, and their care needs. It's important to educate yourself on your loved one's situation. A team could include a geriatrician like Dr. Katz, the ancillary services, which include podiatrist, dentist, eye doctor, cardiologist, other medical specialties. Consider integrative medical support as part of the team, such as acupuncture or CBD for pain management or other holistic alternatives. The team should also include some type of mental health support. This is so important. A psychotherapist or a psychiatrist, which is now being conducted by telehealth and covered by Medicare and other insurances. A psychotherapist provides traditional talk therapy, but really so much more. They help people make changes with their feelings and attitudes and develop healthier behaviors and patterns. Psychiatrists do more of the same, but have the ability to prescribe medications for any mood disorders. Another key part of the team are family and friends. You need to consider what support systems this person already has in place and try to build upon that. And lastly, an aging life care specialist like myself, otherwise known as a geriatric care manager, can help you build a team based on professional assessments of your loved one's care needs. I hope your toolbox now includes techniques that will give you a better understanding of your aging loved one's circumstances and has taught you new communication skills, as we've discussed in the previous slides. Another important tool is to cultivate patience through meditation and self-care. I'm going to say that one again. Cultivate patience through meditation and self-care. Patience is a virtue, and it's absolutely needed when dealing with aging. Strong self-care principles ensure that you're putting on your oxygen first before you try to assist others. So refusal of care. What if we've used all of our new techniques, understanding where they are, how they view their circumstance, listening and choosing gentle words and redirecting conversations, and trying to develop that team, and our loved one still refuses care? Well, what we want for our aging loved ones is not necessarily what they want for themselves. Sometimes it requires loved ones to step away from the situation, but still be available when needed if things don't work out. If a loved one is refusing care and has capacity to do so, they are allowed to make poor decisions. I know I've made many. Consult with a doctor or another professional if you're concerned about your loved one's safety, and they can assess if it's safe for you to step back or what interventions may be needed. I'd like to touch on COVID. This has been such a difficult time, and the effects of lockdown have limited social interactions, especially for our elders. Some of the ways to combat the negative effects of social isolation include set up virtual communication platforms such as iPads and simple computers, and ensure that they understand how to use the equipment, how to access online programs, or even how to use the TV remote. Share a meal on FaceTime or Zoom. This allows you to enjoy a meal face-to-face conversation, which was usual dinner events prior to COVID. Suggest projects that encourage reminiscing. They have books where you can fill out about your life and you can give it to a grandchild, or have them look and label old photographs and identify who's in them, when it was, and where it was. Reminiscing can be a very therapeutic, soothing tool as well. There are volunteer opportunities that are available in the home. You just need to get creative when you're thinking about them. There's something called a birthday box. You can buy birthday hat, paper for cards, placemats. You can decorate all of them. You can put it in a box with maybe a box of cake mix, a thing of frosting, some sprinkles, maybe a thing of balloons. And if you bring it to the Center for Food Action, they'll give it to a child in need who's celebrating a birthday. What an incredible gift to give to a child. Or you can make peanut butter and jelly sandwiches for the homeless. Our homeless in Bergen County need to leave the shelter between 9 and 4, and they're usually congregating outside. What a beautiful thing to hand out peanut butter and jelly sandwiches to warm their hearts and warm their bellies too. The Federation has supported ongoing programs and activities geared for our homebound elders, including Kosher Meals on Wheels and senior activity centers. The Federation also supports elders by providing iPads and technology to help address those challenges of social isolation. You can send care packages to your aging loved ones. There are so many of crafts, cooking, activity boxes, and that provides them with in-home activities. My top recommendation for combating the effects of social isolation is hiring a licensed home health aide. They can provide personal assistance and company to our elders. They follow the CDC recommendations for COVID prevention. A licensed home health aide can also assist in keeping our elders active, engaged, and with purpose. They also can be the eyes and ears for family, so you know really how your loved one is doing. I heard of something new, and I thought this was so creative, called pandemic pods. Seniors are forming pandemic pods to ward off the winter isolation. These pods consist of small groups of elders that may live in the same building, who agree on pandemic precautions and only see each other in the months ahead. You could even hire a home health aide that can work with all of the people in the pandemic pod and help bring them together. What a great creative way to deal with the isolation. Lastly, if there's a COVID concern about going to a doctor's office, I want you to know that there are various Dispatch Health hospital-based programs and visiting doctors who can evaluate you in the home. As mentioned, all this information will be on the Federation website. Since I have the attention of 70 plus people, I need to mention that November is Alzheimer's Awareness Month. And I wanted to use this opportunity to share some information about Alzheimer's and other dementias. Approximately 5.7 million people in the United States currently have Alzheimer's and dementia, and someone is diagnosed with this disease every 72 seconds. This is projected to triple to 16 million by the year 2050. Alzheimer's and dementias often start 5, 10, or even 20 years before symptoms appear. It's not just a disease of old age, as 200,000 people under the age of 65 currently have early onset Alzheimer's disease, and these numbers are growing rapidly. The Alzheimer's Association offers many programs that enhance care and support those affected. One great resource they have it's an online tool called the Alzheimer's Navigator. This tool helps create personalized action plans and links you to information, support, and local resources. Please, if you're assisting someone with dementia, do not do this alone. Call the Alzheimer's Association. Your team will be your lifeline. The topics tonight have been pretty intense, and I think that it's really important to keep your sense of humor. So this is a gentleman trying to get a prescription filled, and the entire healthcare system is bombarded with aging boomers, and they're telling him to come back in 20 years. Keeping a sense of humor, again, incredibly important. So thank you so much for joining us. And now we're going to open up to question and answer with our moderator, and she'll begin now. Thank you.
Margot.
I'm trying to take my sheet. Oh, go ahead. I'm trying to take the screen off.
Okay, I'll give it a second.
Thank you.
The first question I have is, where do you find out about the pandemic pods?
I really don't know the answer to that question. I just heard about it. So I think it would be, if you have someone who's living in a building and you know that they have friends there, maybe, someone needs to facilitate them to get together and form this pandemic pod. I mean, it's really a new concept, but I think it's an interesting one at best.
Great. Another question for you, Margot.
Yes.
When Terry might be able to answer this as well. When do you know when a loved one isn't safe to drive any longer?
Well, maybe Terry can answer that part of the question and I can answer the how do you talk about it.
Okay. Am I on?
Yes.
Yeah, okay. I always tell people that it's really the best way to know if someone can drive or not is to have them go for a driving evaluation. There's really taking away someone's license is about the worst thing that happens to people. It's very traumatic, particularly when it's sometimes it's very clear that someone can no longer drive. But when they're kind of on the line about it, I make them go to a driving evaluation. There's a therapist, and they get in the car. They do simulations. They do cognitive testing. They test their coordination. They test their vision. And Kessler has a program. The Jewish Home used to have a program. I'm not sure that's still into play, but
Okay.
I always tell people you need to do this, because I cannot evaluate someone. I mean, sometimes I can and say you can't drive, but when it's not clear, it's not fair to take it away if they really can handle it.
I think it's important that the conversation gets started by a doctor and it doesn't come from a child trying to tell a parent that they can't drive. This way, the doctor will make the recommendation and then the family can support what the doctor said. And the anger won't be geared towards the family. I'm sorry, it may be geared to the doctor, but at least the family can have these conversations and support that someone is not safe. And I think when somebody goes for one of the driving evaluations, it's important to keep it very positive, that they're going to have their strengths and their weaknesses tested, and that with their weaknesses, they're going to try to teach them how to compensate for that. So it's more of like a positive thing. And then it's really important to have some kind of transportation system in place for them, whether it's a driver or the county transport, or there's something unique called GoGo Grandparent. It's a company that started with monitoring Lyft and Uber. So instead of using a smartphone, you call a phone number. They actually track when the person gets picked up and when the person gets dropped off, and family can get those texts and see that and know that a loved one got from point A to point B. So just setting some things up for them is really important.
Okay, another question is, how do you figure out if your loved one needs to go to an outside facility? And what if they fight leaving their home?
That the decision, you mean, when does someone decide that they can no longer live in their home where they've been living?
Exactly.
I'll stay just a little bit. Margot is very speaking beautifully. I think that the decision depends on more than just their physical being, their skill set. It depends on finances. It depends on cultural expectations. It depends on religious beliefs. It's their social skills. I mean, somebody could be with 24-hour care in an apartment and be safe.
Mm-hmm.
However, that's very isolating. And so the aid, it can be hard to get good aids. There are a lot of great aids out there, but it can take a while. So having 24-hour help is always an option. At the same time, if you take somebody who's never been social and you say to them, this is better because you're in assisted living and I know you're safe, and now I can sleep at night because I know you're safe. But meanwhile, the person is miserable in that environment, who are you really helping if they're miserable? So that decision is often a long discussion. Sometimes it happens abruptly. Again, somebody has some catastrophic illness and they simply can't be home. They require more than one person to help him. Then it's time to leave. But I'll let Margot, I'm sure she has some comments because she deals with this all the time.
This is a very challenging situation. And like Terry said, there are just a lot of factors that go into making these decisions. Yes, you can get wonderful 24-hour care. And as you heard when I spoke, there are a lot of things that you can do creatively to enhance somebody's life and enhance their day-to-day. The goal is for them to thrive, even under the circumstances that they're facing. When you move someone into an assisted living, the assisted living really tries to help the person acclimate to the community. And it's really, I think it's a good idea that if you're going in that direction, go to the facility, have lunch, let them have a sense of what the place is like and get a feeling, is this a place that I maybe could feel comfortable in? I mean, if you have the ability to do that, that's a wonderful way to handle the situation.
Okay. Sorry, I'm having a little bit of a technical difficulty.
AC, they're in the, this is Donna Weintraub. They're in the Q&A. Can you find them in the Q&A? I put them in the chat.
It's okay. Are facilities making any changes based on initial experiences and protocols with COVID?
Oh, God, it changes every day. The facilities are so much more prepared. This is it's very sad for me to talk about this. It's not easy because for those of us who were in the middle of COVID in the facilities, nobody can imagine how that felt. And the facility during March and April, they were so short-staffed and nobody really understood. But let's move forward. On the positive note, most of the facilities have very detailed plans in place. They have isolation, they have quarantine, they're testing every week. They've got air filtration. They all have PPE. And I think the health field is trying to tell people, if you need medical care, don't hesitate to go for it. And by the way, masks work. I've been around a lot of COVID. My daughter's an ER doc. She's been around a lot of COVID. The masks do work. I'm very convinced that PPE works. So if somebody is sick, they do need to go get medical care. On the other hand, I'm not going places. I'm not going to public places. I just think this is a good time to say COVID has come back. There are 20 or more cases in Englewood Hospital. We now, after having no cases in the facilities, we have cases again in the facilities. Most of them come from the hospital and they're recuperating because we do so much screening. People get tested before they leave the hospital, when they get there. So we don't have that many de novo cases, but everybody is really on top of this right now and aggressively trying to prevent it. And let me just add one other thing. There's new medications. There's a new drug that was just approved. That's a monoclonal antibody that's being touted to be used in early disease, which, is the first time we've heard of that. And we're waiting to see how that's going to roll out. It just got approved, I think, on Tuesday.
I'd just like to add that Governor Murphy signed legislation requiring reforms to long-term care facilities, and the bill establishes a minimum staffing ratio and requires policies to prevent social isolation of their residents. I think that's pretty interesting. That's all I have.
Sorry, we're just having some technical difficulties. I'm going to ask the next question. Someone asked, why do you think Alzheimer's is occurring earlier in age?
I'm not sure. I'll start, Margot, unless you want to start. Do you want?
It's very hard to answer that question. There are some studies that say our lifestyle, the things that we use around us, the toxins, all the the bad food and all of that is culminating to cause some of the dementias. So I'm not really sure how to answer that. It's hard to know.
Yeah, and I also think some of it that's being recognized earlier. I don't know. I'm not 100% sure if the age is really changing as much as it's recognized. I try to tell people to get cognitive testing done. So I'm not sure that it's earlier. I'm not sure about that.
I can read you the next one.
Thanks.
It's okay. I need safe transportation within Bergen County between my home and Hackensack University Hospital. And for various reasons, they can't use an Uber and they can't rely on their family. And the question is there inexpensive non-public transportation available within the county for for that type of transportation?
There is. So there's actually free transportation in Bergen County. I'm forgetting the name of the program right now, but it will take you to doctor's offices and important appointments and such. And they are wheelchair accessible and geared for people who are handicapped.
That's wonderful. Thank you. The next question, I guess, well, we'd have to Google that, or perhaps that came from Karen. So Karen, perhaps you can Google that or reach out to Federation's offices and we'll see if we can't get you that information.
Oh, she wrote it.
The next, sorry, Terry?
Access.
Somebody wrote in, it says access link.
Yep.
Somebody put it in the bottom. Access link, it says.
Okay, I will put that into her chat afterwards. The next question was, I have a family member in the hospital right now and may need to go to rehab or come home with full-time nursing care. Given the risks of COVID, what are the pros and cons of going to a rehab center versus coming home with care? And how do you best assess a parent's needs against the risk of him or her getting COVID?
I guess I can answer that. So generally speaking, when you go home from the hospital and you're getting therapy from basically that's usually Part A Medicare, I don't know all the insurances, that usually gives you therapy about 2 or 3 times a week, a visiting nurse that will come in once or twice a week. So so for some people that may be enough therapy, and they could try going that route. It depends if they live alone. If they live alone and they can't live alone, then obviously it's not a choice. Therapy, when you leave the hospital and you go to subacute rehab and you go to a facility, you generally get therapy 2 hours a day, 6 days a week, or at least 5 days a week. And of course, there's nursing care and there's CNAs and such. So I know that there are a lot of orthopedists now that are pushing their patients to not go to subacute rehab because they are worried. And I don't think it's an unreasonable concern. As much as I say nursing homes are safe, it's not unreasonable to worry about that. But if you need more therapy, if you can't be alone and you don't have the support, then you should go. And it's a big mistake to try to go home when it's really not the right decision, because then you risk, developing, a fall and having an accident, or developing pressure sores because you can't move yourself. So again, I think that discussion should be done with the doctor, with your family, and to look at the rehab facilities as well. They're not also bad. Some of them are very good.
I'd like to add to that for the rehab facilities, I just lost my train of thought. Oh, if you go home, you can still go to a facility within 30 days of a discharge from a hospital. So you can try the home rehab, and if it doesn't seem to be working, then you can still get into a rehab. It's a little more challenging with the paperwork and such, but it's easy.
It's actually not a problem now because the facilities actually are not full, and to be honest, so they do want residents and patients. And the other thing is, it used to be a 3-night minimum stay. And that they kind of they did away with that, and I think that's still in effect, that you can go from a 1 or 2 night stay in the hospital and get an exemption and go for rehab. But it's a little bit more challenging. But I just did it the other day. I took someone, the facility took them right away. They just get off the hospital records. That's a very good point, though. Very good point.
I have to say, and again, this is Donna, for you can't see me. I have to say that just answering these last few questions is a perfect example of why families need a team of support to work with in order to, navigate around the challenges that are impacting their families, and in particular for the people that they care so much about. I personally was blessed with working with you both when it came to my beloved mother of blessed memory. There was nothing that my husband and I felt worked better for us than having a caring team that we were able to turn to, who had the expertise to understand the things that we were first navigating for the first time. I think personally listening to the session tonight and what both of you had to share really covered just about everything that we went through and everything that we were able to, to find the support in with really working with a wonderful team. So I hope everyone on the Zoom tonight felt, or at least felt a good basis and a foundation for understanding and realize the importance of just all the things that you had spoken about. And I'm just gonna let everyone know that again, Margot Tucker had said that all of this information will be available on the website. There were other resources that you can reach out to within the county. Federation is here to help. We do everything that we possibly can to do as much as we can for our aging population, and to make sure that we care deeply and that it comes through in the values that we have as an organization. I want to thank you both very much for helping us navigate this challenge tonight. And I'm going to turn it over to Karen, who's going to introduce Dina Bassin to share some personal story about her involvement in this area. Karen, are you going to do that? Is that
Yes,
right?
I am.
Because Stacy's not able to get on.
Okay,
Great.
I'm here. I'd like to introduce Dina Bassin, Women's Philanthropy Campaign Co-Vice President. Dina?
Josh fixed the problem.
Are you there?
Yes, I'm here. I'm sorry. I was
Okay.
muted. I'm going to talk about my experience with kosher Meals on Wheels, but I'm going to take you from the very beginning. For years, my friend Tina and I used to sit at the bar at Axia, contemplating our lives, our families' lives, and our friends' lives. We discussed all topics to exhaustion. Me with a dirty martini in hand, and she with her usual margarita on the rocks. One evening, 12 years ago, we decided we needed more, not more drinks, but more meaning in our life. We needed a new purpose outside of our bubble. Many people in need in our community turned to Federation for help, so we did the same. Federation put us in touch with their partner agency, Jewish Family and Children Services. We became volunteers for the Kosher Meals on Wheels program. Volunteers deliver more than 50,000 kosher meals each year to homebound seniors and disabled individuals, while also providing meaningful social interaction with the recipients. Sounded perfect for us. We started as delivery girls, but soon became friendly visitors to an incredible woman named Alva Glazer. For 8 years, we gave her companionship and meals, and she gave us love. During our visits, we played dominoes, worked on puzzles, watched tennis matches, and even gossiped about the Kardashians. Alva clipped coupons for us, made us snacks, and invited us to her 90th birthday party. When the phone would ring during our visit, she would answer with an unrecognizably impatient voice. "What do you want? The girls are here. Call me back later." We were clearly important to her, but I didn't yet realize what she truly meant to us. It was a cold and gloomy day in the fall of 2018 when her granddaughter notified us that Alva had fallen ill. She was admitted to the hospital. We rushed to her bedside with flowers. but I don't think she knew we were there. She died a few days later. At the funeral, her daughter Deborah thanked Jewish Family and Children's Services in the eulogy. She was grateful for the kosher meals and the companionship they provided for her mom. Heartbroken, Tina and I decided to make one final food delivery that evening. This time it was for Alva's family that was sitting Shiva. We continued delivering in search of another Alva. It wasn't easy. We were close to quitting Meals on Wheels. Then COVID hit and everything changed. The demand for kosher Meals on Wheels increased by 53%, or about 3,200 additional meals a month. Federation increased funding, and the Jewish Family of Children's Services was able to meet the needs of the community. We added many new clients to our route and delivered more often. Tina and I masked up, put on our rubber gloves, and became essential workers. The new delivery procedures for the pandemic reduced our social interaction down to a wave at best. Well, except for Norman, of course. He sits on his stoop while we stand maybe 20 feet away on his lawn and always has a lively conversation with us. Sometimes I wonder if Norm orders the meals just for social interaction. Regardless, we feel so good helping any way we can. We are an important part of their lives, and it's empowering for us. I can easily say the Jewish Federation of Northern New Jersey has done more for me than I have done for them. Alva will always be in our hearts, and we know there's plenty of room for others, namely Norm. Thank you, Federation.
Sorry about my previous technical glitch. Dina, thank you for that heartwarming story. Volunteers like you mean so much to our community. Thank you, Terry and Margot, for such an informative and interesting evening. Your guidance and insights are compelling. As evident by the number of people participating tonight, caring for our aging loved ones is a big concern for many families, mine included. The Federation is aware of the pressing issues faced by the seniors in our community. During COVID, over $30,000 was allocated to the Kaplan JCC for meal delivery to seniors who normally participate in the congregate meal program. During COVID, we also continue to allocate dollars to our community's kosher senior Meals on Wheels program, which is organized through Jewish Family and Children's Services. As the year 2020 comes to a close, Federation's funding efforts are ramping up, knowing that every dollar we raise will be addressing the emerging needs in our community. If you haven't made a gift to Federation, maybe today is the day. If you have, we thank you. Have a great night, stay healthy, and we hope to see you in the near future.